Hi everyone, let's continue the second part of how Kerala tamed the coronavirus. That evening, Kerala's health minister, K.K. Shailaja, arrived from the state capital. A former science teacher, she'd already gained a reputation for her prompt and efficient handling of the unfolding crisis. The media had nicknamed her the coronavirus slayer. While the rest of India, along with countries such as the UK and the US, wouldn't take stringent steps to limit movement for another 2 months, Shailaja had ordered Kerala's 4 international airports to start screening passengers in January. All those with symptoms were taken to a government facility, where they were tested and isolated. Their samples were flown to the National Institute of Virology 700 miles away. By February, she had a 24-member state response team coordinating with the police and public officials across Kerala. This was unusual, but Kerala often goes a different route from the rest of India. The small, coastal state at the country's southern tip is steeped in communist ideas and governed by a coalition of communist and left-wing parties. Kerala has maintained its focus on social welfare. Its healthcare system is ranked the best in India, with world-class nurses who are headhunted for hospitals in Europe and America. The state's life expectancy figures are among the highest in the country. The minister's arrival in the district reassured New. He wasn't on his own. The machinery of the entire state was at his disposal. The seriousness of the government was amazing, he says. Each team on his task force was increased from 6 people to 15. Kerala's health minister, K.K. Shailaja, a former science teacher, quickly gained a reputation for her handling of the unfolding crisis. The media nicknamed her the coronavirus slayer. By March 9, around 48 hours after the family tested positive, news teams had a map and a flow chart listing each place they had been, when, and for how long. The information was circulated on social media, and people were asked to dial a hotline if it was possible that they had interacted with the family. News office was flooded with calls. The family had met with almost 300 people since arriving in town. Now the teams had to track down these people, gauge their symptoms, and either send them to the district hospital for testing or order them to self-isolate at home. The number of people self-isolating quickly rose to more than 1,200. Still, New knew that people who agreed to self-isolate wouldn't necessarily do it. So he set up a call center in his office, bringing in more than 60 medical students and staff from the district's health department, whose job was to call everyone isolating every day. The callers ran patients through a questionnaire meant to assess their physical and mental health, but also to catch lies. If anyone was caught sneaking out, we had the police, the revenue department, and village councils ready to act, News says. But the carrot was as important as the stick. His office also delivered groceries to those in need. The district was placed on high alert. New wore a mask, scattered bottles of hand sanitizer around the office, and reverted to the old model of namaste rather than shaking hands. This was now ground zero for the Covid-19 crisis in India. On March 11, the WHO declared the Covid-19 outbreak a pandemic. The next day, India reported its first death. Even so, Modi, perhaps concerned by the impact on the already lackluster economy, refused to issue public advisories and didn't address the media. In Kerala, a different style of leadership was on display. With 15 cases now confirmed across the state, Pinarayi Vijayan, the chief minister, ordered a lockdown, shutting schools, banning large gatherings, and advising against visiting places of worship. He held daily media briefings, got internet service providers to boost capacity to meet the demands of those now working from home, stepped up production of hand sanitizer and face masks, had food delivered to school children reliant on free meals, and set up a mental health helpline. His actions assuaged the public's fears and built trust. There was so much confidence in the state government, says Letha George Pottinkilam, a clothing designer in the port city of Kochi, that there was no resistance to modifying one's behavior by staying in. There were other reasons why Kerala was better equipped to deal with the crisis than most places. It is small and densely populated, but relatively well off. It has a 94% literacy rate, the highest in India, and a vibrant local media. Elsewhere in the country, people were taking WhatsApp rumors at face value, for example, spreading messages claiming that exposure to sunlight could protect against a virus. But, in Kerala, most people realized the seriousness of the situation. Manshu Sararajan, the editor of an online design magazine in the district of Kottayam, told me she felt safer living in Kerala than anywhere else in India. "We have been considering the possibilities for far longer," she said. Everyone around her knew the number to call if they developed symptoms, and they weren't acting heedlessly by rushing to the hospital at the first sign of a dry cough. Stay tuned for next episode.